Thank you for joining us this morning for Face the State. I'm Tracy Townsend. Right now, the CDC is getting ready to investigate a measles outbreak in our state. According to Columbus Public Health, the oldest patient, a 6-year-old, was exempt from getting the MMR vaccine, which is part of the required vaccines to enroll in Ohio schools. 10 TV's Lindsay Mills is taking a closer look at vaccine exemptions locally and across the state.
They really do an investigation to try and understand where this outbreak started and who else might have been in those settings and at risk.
Next week, the CDC will send 2 of its epidemiologists to Central Ohio to help Columbus Public Health investigate a measles outbreak. According to the health department, the oldest infected is a 6-year-old who was exempt from getting the MMR vaccine required to enroll in school.
We've had the benefit of great coverage from these vaccines and haven't had to see these diseases. And right now we are starting to see less vaccination in some of these communities and these diseases resurge.
Of the 19 Columbus area measles cases, Columbus Public Health says all the children are unvaccinated. According to the latest data from the CDC, 89.6% of Ohio kindergartners had the MMR vaccine in the 2020-2021 school year. The U.S. median for the same year, 93.7%. In Westerville, this school year marks the highest number in the last 5 years of total students who opted out of required immunizations for philosophical or religious reasons. That number, 413, accounts, though, for less than 3% of students. And in Reynoldsburg, according to a district communications director, the number of immunization objections for all required vaccines remains low, with less than 1% of students opting out the last 2 school years. Health officials in Central Ohio and across the country urging parents to stay up to date on their child's vaccinations.
This is just critically important.
That's Lindsay Mills reporting. Exactly what will the epidemiologists from the CDC do while they're here?
So they'll do a lot of family interviews and interviews of people. Where have they traveled? Where have they been? Who is of these cases that have been in contact? Have they been in contact with one another? Have they been in similar settings? Did one leave a daycare setting, for example, before another came in? Could it have been circulating that way? So they really do an investigation to try and understand where this outbreak started and who else might have been in those settings and at risk.
Columbus Public Health launched a website to track this measles outbreak, and you can find a link to it at 10tv.com/featured links. There's also a big concern about winter-time illnesses being on the rise in Ohio. RSV, influenza, and COVID-19 are among the top concerns. We also asked the CDC director about what you need to do this holiday season to keep your family healthy.
So certainly what we always see during the fall and winter season is a rise of respiratory viruses. We are seeing that now, not just with RSV, but also with an early influenza season, as well as the ongoing concern of COVID-19. So the most important thing that you can do is to all those preventive measures. Most importantly, get vaccinated. If you're eligible for that bivalent vaccine, everybody over the age of 5, go ahead and get that bivalent vaccine. Certainly everyone over the age of 6 months old is eligible for that influenza vaccine. So go ahead and take those preventive measures by getting vaccinated. That protects you, that protects your loved ones, that protects everyone around you. In the meantime, though, if you have those symptoms, go ahead and stay home. Or if you're around others who have symptoms, you want to try and avoid those with symptoms. You can always consider wearing a mask. That prevents not only COVID-19, but also other respiratory infections, and then improving ventilation wherever you're going.
In Columbus, city leaders are working on gun control legislation that they want drafted soon. The proposal would prevent ordinary citizens from buying large ammunition magazines containing more than 30 rounds. It would also require gun safety locks. This week, there was a public meeting for comment on the proposal. The majority of the people spoke out in support of the change.
This is what this situation demands. This is the response our residents deserve. Our city's comprehensive neighborhood safety strategy is just that. It's comprehensive. It's holistic. It encompasses prevention, intervention, and enforcement techniques, and it continues to grow and evolve with each passing year.
So I applaud the City Council for taking upon itself what the state legislature has been unwilling to address. I'm particularly grateful for your consideration of the prohibition on high-capacity magazines.
Impact Community Action will soon have a 90% reduction in emergency rental assistance funding. The funding will take a dip next year from $60 million to $6 million. Anyone who has applied for rental assistance already will receive their funding, but come mid-December, the online portal will be suspended and 39 temporary employees will lose their jobs.
The reality is our population is growing faster than our ability to build housing. We've seen rent increases, housing price increases, and increases across the board. And so there's some tough economic times ahead.
Impact hopes the state legislature will pass new funding during this lame duck session, which would be a new $36 million. Their swift reaction to a new resolution rolled out by Ohio Republicans to make it more challenging for citizens to amend the state constitution. The Ohio Constitution Protection Amendment, according to Secretary of State Frank LaRose, is aimed at preventing abuse by special interests and out-of-state activists. The new amendment would require petition-based amendments to pass with 60% of the vote instead of a simple majority.
I also think that it's important that that we continue to encourage that kind of consensus building. And I think that if you don't think that your idea is broadly popular enough to muster 60% vote of the people, then maybe you should not consider bringing it to the ballot.
Catherine Terser from Common Cause, a government watchdog organization, told me the proposed change flies in the face of the Ohio Constitution since 1912, when citizens were given the ability to collect signatures and for voters to propose amendments to the Constitution.
So one of the things that Secretary LaRose said when he first talked about it at that Impact conference, he said, hey, this is for the business community, especially the Chamber of Commerce. And then he talks about how, okay, it's special interests who are trying to, make the Ohio Constitution longer. And you're like, well, wait a second. First of all, we're not California. We don't have a long list of citizen initiatives every year. Our voters, Ohio voters, are more conservative. And by that, I don't mean that they're, Republicans. I mean that they're more cautious. We tend to be really thoughtful and not pass everything that is put before us, which I think is a really good thing. I just don't understand what the problem is. And I especially find it galling that the secretary is proposing a 60% vote for those efforts that are led by the voters of Ohio, his constituents. And in fact, he wants the state legislature just to have a simple majority vote. It's just unfair.
Because it's hard to reach a 2/3 or 60% threshold.
Absolutely. It's incredibly difficult to do a citizen initiative, period. You're talking about, at minimum, half a million signatures. And just, imagine all over the state. Imagine worrying about fire, all of the different things. There are a lot of obstacles to citizens getting their measures on the ballot. And yet, don't voters want that opportunity? We've had it for more than 100 years, and there's no sense in making it more difficult.
U.S. Senator-elect JD Vance is getting familiar with Washington, D.C. Senate Minority Leader Mitch McConnell welcomed newly elected Republican senators shortly after the November 8th election. The group gathered in his office, and Senator McConnell made brief remarks encouraging them to, quote, accomplish something during their time. We asked Senator Sherrod Brown what he thinks of Vance's victory.
I called Senator-elect Vance the day after the election and congratulated him. It was a very good call. I said to him that Senator Portman and I, even though we differ greatly on issues, Rob was for trade agreements like NAFTA. I fought them. Rob wanted to privatize parts of Medicare and Social Security. I think we should strengthen them. Major differences on issues. But as I said to JD, we found ways to work together for Ohio. And that, it could have been an infrastructure project at the 7170 interchange. It could have been something with state government, whatever. We found ways to work together. JD Vance and I talked about doing the same things. And even though we disagree on the big issues, we put partisanship aside when it comes to working with state government, when it comes to working with people in Ohio. And I'm confident JD and I will do that together the way Rob and I did.
Still to come on Face the State, shipped out on your dime. 10 Investigates told you about the allegations of abuse and neglect at behavioral treatment facilities.
This system is very broken. It is statewide. It knows no boundaries. It goes way beyond Ohio.
Our story now catching the attention of lawmakers and advocates. Also, as we wrap up Movember, we hear from a local medical student who's living proof of its importance.
It's incredibly profitable to do so, and you have a lot of desperate parents or desperate caseworkers that need somewhere to put their troubled child.
10 Investigates found Ohio children are being shipped out of state to facilities with allegations of abuse and neglect. And where the kids go, millions in public dollars have followed. 10 Investigates has reported on behavioral treatment facilities for years, which now has the attention of 2 U.S. senators. Here's Chief Investigative Reporter Bennett Haberly following a trail of big profits and big concerns.
Police and EMS arrive at a Michigan behavioral treatment center.
He was being restrained for some reason. I don't know why.
Surveillance video sheds light on what happened, showing 16-year-old Cornelius Frederick throwing a sandwich at his peers. He is then shoved and restrained by staff for more than 8 minutes.
We heard him go like something like that, so I'm like, all right, let's lift him up and sit him up.
When they let up, he's unresponsive and dies 2 days later.
So you're laying on him, and there's people on each limb, basically, about 5 of you.
In wake of Cornelius's death, the facility closed. 3 staff were criminally charged, and boys from across the country were sent back home, including Damar Bowden, a 17-year-old from Columbus.
I've been locked up out of state, so you ain't feeling how I feel.
His mother, Damara Harris, told me her son's behavior led to run-ins with juvenile court and placements at facilities in Pennsylvania and Michigan.
Around the time that everything happened there, he had already contacted me and said, I want to come home. This is what's happening. These people aren't being, good to us.
Home just 2 months. Damar was killed in Columbus in July of 2020 while trying to purchase a gun from someone he knew.
It's like having them, watching them grow, and just one day it's just not there anymore. It's not a great feeling. It's empty a lot, so.
These stories are not unique, but are part of a pattern where children linked to foster care or juvenile court are shipped out to privately run facilities.
Now that you guys finally killed one of us, you guys want to stop this and feel sorry for us, right?
Where records show they've either caused harm or been hurt themselves. Ohio has used public money to send kids across the country at a cost of nearly $50 million over the past 5 years. Out of the 37 out-of-state facilities where Ohio children are sent, we found allegations of abuse or neglect in more than half of them. We also found Ohio and county agencies continued to send children to these out-of-state facilities even after Franklin County raised concerns about abuse and neglect. Take a look at this, a police report from December of 2020. Franklin County Children's Services faxed an Arkansas Sheriff's Office alleging a child at a facility there suffered chipped teeth, an injured wrist, and a busted lip during an altercation with other kids. FCCS also alleged that a staff member there witnessed the altercation but did not stop it. Ohio has sent children and $8.7 million to 4 different facilities in Arkansas. Inspection records there document case after case of assaults, sexual abuse, and both kids and staff hurting each other. And they're not alone. Nearly $200,000 went to this Indianapolis facility. $4.7 million went to Detroit Capstone. It shut down this summer after state inspectors raised concerns about incidents, including a fight involving an Ohio girl who admitted she struck and then was punched by a staff member.
My present child's from Illinois. I had a case with a kid from Ohio, a case with a kid from Maine.
Jared Medlock is an Arkansas attorney who has represented children at these facilities who allege they were abused.
We've had any number of these cases going for the last 5 years consistently. There's never been a drop-off where we didn't have at least 1 or 2 cases going here in the state of Arkansas.
The nickname that some of us had for it was the misery mill. You would be there, you would be under constant psychological assault, emotional assault, because there were guys there that it was all about pecking order.
Stefan Specht is a former resident of Mill Creek, one of the Arkansas facilities where Ohio children have been sent. He grew up in foster care. His mother died by suicide when he was 2. Father passed when he was 14. Now in his 20s, he says parents should think twice about sending kids to these places.
The only thing that we can do is make parents very aware, sound off alarm bells to the average citizen that if they have a child that is experiencing mental illness, that they should think twice about sending them to one of these well-marketed facilities.
4 companies operate nearly all the facilities where Ohio children are sent. Collectively, their earnings are in the billions. SEC filings show Acadia, with more than 200 facilities, reported third quarter revenue topping $666 million. More than half came from public money. Hi, this is Bennett Haberly with WBNS TV in Columbus. We spent weeks attempting to reach the companies. 2 got back to us, emailing statements that didn't directly answer our questions. UHS said isolated and rare negative events do occur, but that they take appropriate and corrective actions. Acadia's read in part, our facilities have worked to continuously improve our treatment programs and patient care, reduce the number of incidents, and give hope to hundreds of youths who previously had very little. Neither the state nor Franklin County Children's Services would talk to us. In emails, both agencies said they monitor these facilities and have reduced their use. Given what we found, we still had questions and told FCCS in advance we planned to stop by. But when we did, we were told no one was available.
When are you able to come back, I guess?
You guys tell me. We just were hoping to talk to somebody about, how well FCCS is monitoring these out-of-state facilities and why we continue to spend millions sending kids to places that have had issues with abuse and neglect.
The county has repeatedly declined to talk with us, but in an emailed statement said their caseworkers do visit the facilities and ask about conditions. 2 U.S. senators have been raising concerns, referenced previous reporting by 10 Investigates and others, and they have asked the operators of these facilities for more information about the kids in their care. The same day Bennett's story aired, Franklin County Children's Services forwarded a letter of concern from advocates to 10 states, urging them to take, quote, all steps you deem appropriate in light of the information. The advocates had sent FCCS that letter on September 29th. In the letter, they called on FCCS to end the out-of-state contracts.
When it comes to foster care or kinship care, there aren't enough homes that will take teens, and so they often get placed in congregate care facilities when they don't even meet that level of need.
This practice of out-of-state placements, we need to take another look at it, and we need to come up with a different plan. Other states, like California and Oregon, have done away with out-of-state placements. They brought their kids home. Ohio can and should bring its kids home too. We need a plan first.
Do you have an issue you want our 10 Investigates team to look into? We want to hear from you. Email us at 10investigates@10tv.com. Still to come, we look at one type of treatment that's aimed at helping veterans and the push to expand access in Ohio. Right now, there's a push to expand access to transcranial magnetic stimulation therapy in Ohio. It's used to help patients overcome depression and PTSD. Reporter Trent Croce shows us how it's helping veterans.
Retired U.S. Marine Jeff Lindquist is no stranger when it comes to serving others. But when he got out of the Corps in 2006, he says his battles continued through mental health with standard treatments not working for him.
I had tried pretty much everything the VA had to offer for a year or two, or possibly more. And I was just going nowhere fast. I just couldn't get on my own way. I wasn't sleeping.
But around a decade ago, he says his fellow peer and flight doctor introduced him to transcranial magnetic stimulation, which uses magnetic fields to stimulate brain neurons, changing how and when they release to help depression and PTSD.
And he said, we're going to put a magnet on your head and we're going to calibrate that. And I'm thinking, like a magnet, what do you mean?
While Lindquist would eventually go several times a week, it was after his first half-hour treatment. He says he was finally able to do something hard for many veterans: sleep.
I literally lay down and I didn't wake up until the next morning, like 7, 8 o'clock in the morning. And my wife's like, "You slept all the way through. How many pills did you take last night to sleep?" And I was like, "I didn't take any."
Andy Herf, president of the Toledo-based government affairs firm Shoemaker Advisors, says seeing the effects on veterans is why he helped pass a budget amendment with former Navy SEAL and Ohio Senator Frank Hoagland and others in 2019. He says striving for accessibility for everyone is key now.
Ultimately, our goal is to get this covered by insurance companies, because then it really could become ubiquitous. This is something that could be used all over the country.
Herf says the treatments have created a community among veterans they want to recruit more towards, like Lindquist, who has only gone a handful of times since his initial treatments a decade ago.
They've turned it inward and they're helping each other. It's a really powerful thing to see.
I just redirected my life and improved the quality of life so much that they asked me if I want to stick around and help veterans, and of course I did.
The holiday weekend wraps up family celebrations, and for Columbus City school students, teachers, and staff, it's a wrap on what's called Wellness Week. Superintendent Talisa Dixon declared the week of Thanksgiving as Wellness Week in Columbus City schools. For students and teachers, it meant last Monday and Tuesday were remote learning days. Teachers assigned independent work that will be due this coming week. Dixon shared that the transition back to 5 days a week of in-person learning for the first time in 18 months has been challenging for everyone.
One, we wanted to allow our staff, our students to reset. This has been tough. We have continued to work hard during the pandemic. Our teachers and our whole organization has been showing up every day to make sure that our students receive what they need.
And it's Movember. The play on the name of the month is meant to address the reality of men's mental health and suicide prevention, prostate cancer, and testicular cancer. For Sal Gomez, a third-year medical student at Ohio State Wexner Medical Center, Movember is living proof of its importance. He's in remission from testicular cancer. He essentially made the diagnosis himself a year ago. Gomez shared with me that the journey of treatment, which included chemotherapy and recovery, has made him an even stronger advocate for self-care and awareness.
It's known in studies that, patients who have testicle cancer will put off their symptoms for quite a while because men, in that way are just kind of, we're naturally kind of stubborn with health, I think.
Secrets out.
Yeah. So, with men, but also I think just with people in healthcare, especially, people who are in medical school or, whatever, want to be providers or are providers themselves, residents and whatnot.
Mm-hmm.
You get really busy and consumed with your work. You're, we're on rotations on surgery. I was there from like 5 a.m. to 5 p.m. and then I had to study. And so, it was a full day, thing, 12 plus hours of doing things, and trying to go to the gym and, other responsibilities and things like that. But really my message is that your health is what's most important. You can't help other people if you're not healthy yourself.
And Gomez took a break from medical school last year, but is back. He started his internal medicine rotation this past week. He also got engaged and is sharing his story with other med students so that they can advocate for their own health. We certainly thank you so much for joining us here on Face the State today, and we wish you a great week.